All right, so this video is going to take you through a full body joint and movement sequence. We have our demonstrator and model, Jenna, on the mat, and then all you need is some wall space and 2 yoga blocks and some sort of a mat for cushioning. So we'll get right into it. Jenna's starting in a low bridge position, and what we want you to start to do is just kind of drop into your body and focus on your breathing. So on an inhale, I want you to focus on your belly expanding and opening up. And when you breathe out, I really want you to think about trying to shrink the belly down or pull your navel closer to your spine. Okay? And that's all we're going to do right now, a couple of times through. So you're breathing in, your diaphragm is dropping down. And then when you breathe out, your diaphragm is going to pull up into the rib cage. Okay, after you've done this a few times, you can start to add some lumbo-pelvic motion to the sequence. So when you take an inhale, I want you to go into an anterior pelvic tilt or tip your pelvis forward so the small of your back lifts off of the ground. And on an exhale, you're going to go into a posterior pelvic tilt where you round your tail between your thighs and your low back pushes into the floor. All right, and you can do this anywhere from 4 to 12 times. Again, I want you to try and use your breath as the driver of the motion of your lumbar spine and of your pelvis. All right, additional things to think about here are your feet and your hands. Okay, so you're pushing into your palms. And then if you think of the tripod of your foot, one point being below your big toe, your little toe, and then the front of your heel, you want to have this firm connection with the ground through the bottoms of your feet the entire time. All right. Now, I want you to get to a place where you can flatten your spine. Okay, so the spine is flat, but you don't feel like you're in too much of an anterior tilt or too much of a posterior tilt. And then lift your arms up toward the ceiling. All right, hands are going to face toward each other. And then when you take a breath in, you're going to reach your arms back, trying to keep your shoulders plugged close to the ground. And then on an exhale, bring them all the way forwards by your thighs, by your pockets. All right, and we'll do this a couple of times. So all we're doing is we're warming up the front and back part of the shoulder capsule. All right, and again, the spine is staying flat the entire time. Your knees are parallel to one another, so they're not falling out and they're not caving in. They're in line with the second toe, and then you're just starting to move your shoulders. All right. And then the next time you bring your hands forward, you're going to place them strong on the floor, keep your spine flat, and then just begin to pick up your feet. So you're in a 90-90 position. Okay, now if you notice the small of your back has come up, if you pull your thighs closer to your chest, it'll help to push your spine down, and if you push your thighs further away from your chest, it'll start to challenge and lengthen your abdominal muscles, making it harder to keep the spine down. So you take a couple of breaths here. You can progress this movement by reaching your hands to the ceiling. All right, and then to make it even a little bit harder, you can take your hands back on an inhale and then forward on an exhale. All right, and you can do that 1 or 2 more times, keeping your ankles flexed. All right. And bring those feet back down. Now let's say that was difficult for you. You could also take a yoga block. You would put it the medium way, so the second widest way between your thighs. All right, you would pick the legs up, and you could do this exact same motion, but now you have the inner thigh engagement, which is going to help kind of recruit your transverse abdominal muscles, which is going to be that deep core set of muscles that's kind of like a corset and attaches your rib cage to your pelvis. Anyways, Jenna is going to bring her feet down. Hands can rest somewhere by the sides. So she's in a low bridge position. As she presses into the soles of her feet, her hips are going to lift up just a tiny bit. And I think what's important to remember is less is more. So the higher you go with the hips, the more challenging the next exercises are going to be. Okay, so from here, she's going to extend her right leg forward and up at about 45 degrees, and she can move her ankle around a little bit. She can move through flexion, extension. She can do the ankle rotations. She can just spread her toes and relax her toes. It's more about what you want to do to distract the mind while your left glute and hamstring is starting to turn on. And then you can bring that foot down. Let's do the other side. All right. All right. And then she will take her foot down. Okay. Whole spine rolls to the floor. Okay. Legs will come up to a 90-90 again. Hands go up to the ceiling. And this is also known as a dead bug position. All right. So you take a couple of breaths and you want to see if you can inhale and expand the belly like when we started the warm-up, and on an exhale consciously, actively pull that navel down to your spine, so you're starting to create an intra-abdominal pressure at the front of your low back, helping to improve the stability and strength and comfort of your spine. All right, and then she can grab behind her knees and maybe just rock side to side. Okay, so it's a simple motion, just kind of smoothing out any work we did. All right, and then we're going to come up to a tabletop. All right, and this is where we're going to start moving a little bit more. So ground-based warm-up is mainly to just kind of tune into the body, but get the nervous system ready for the more advanced movements, which are going to be in a quadruped position, like she's in now, or a prone belly down position, or even a standing posture. Okay, so first thing we're going to do is if Jenna flips her toes under, all right, and we're going to ask her to go to like somewhat of an active child's pose. So she's going to pull her hips back towards her heels. All right, and you notice it's not a resting child's pose. She's just working her hip flexion. Then she comes forward. All right, she's going to point her toes, so putting her ankle in the other position, and she'll do the same thing. Hips will go back. All right, and then forwards. All right, now you can change the toes again, and you can do this a couple of times, as many as you'd like. The entire time you want to be thinking about, am I lengthening my spine? Okay. And then also it's that hip flexion and shoulder flexion happening simultaneously. All right, and then if you take your right hand, put it on your left hand. All right, and then send your hips back into the right. All right, and this will just start to get the side ribs a little bit more. And again, you can do this 1 to 4 times. Let's do the other side. So switch hands. All right. Fantastic. Okay, and then we come to a tabletop. All right, so from here, we're just going to warm up the shoulders a little bit. So I want you to take your right arm out to a T. Okay, and then about 4 axial rotations. So as if you have a rod from the middle of your armpit out through your middle finger, and you're just going to internally and externally rotate that arm as much as you'd like. And then we'll change sides. Nice. All right. And then if you come down, we'll walk your hands back to your thighs. You're in a tall kneeling position. Okay, so we're going to go into hip flexion, hip extension. So she's going to practice sitting her hips on her heels and then just coming up. And then she'll change her toe position. And you want to spend a little bit more time doing the one that causes more discomfort, so that we're developing the adaptation, or we're getting the brain to recognize the pattern that we never go to. All right, nice. Then she's coming tall. All right, so this is a tall kneeling. She's in hip extension. If you take your hands to your sternum, and we'll just warm up a little bit of lateral flexion of the spine. So we're going to let the rib cage and the head side bend right. Okay, so this is a right lateral flexion. Then she'll come through the middle and she'll do a left lateral flexion. Okay, and something that's important here is your inner thighs, keeping them tractioning toward each other. Let's do one more to the right. and then to the left. Okay, and now we're going to make it a little bit more advanced. So on the next right lateral flexion, you're going to go to the right and let the head go to the left. So you'll see her neck is now bending to the left. As she comes through the middle, she's going to side bend left and try to get her head to go right. So now we're starting to introduce oppositional training, okay? So the spine bends one way, the head bends the opposite way. Okay, and although it might kind of feel difficult and or look a little funky, every time we take a step in the world, this is actually happening with our thoracic and cervical spine. All right, come to the middle. All right, and now we're going to do thoracic spine and cervical spine together. So side bend right. Yep, and then rotate right. There you go. So she's adding a right rotation while she's trying to maintain a left rotation of the pelvis. All right, she'll come through the middle. We'll do a lateral flexion left and a left rotation. All right, you'll come back to the center. And now staying, so this is a neutral position. I want you to see if you can do a right rotation of the rib cage. Head stays straight. There we go. So you're going to notice that Jenna's head doesn't deviate from looking forward. Whenever you're ready, you can do the next side. Okay. And what you might notice, why don't we do 2 incorrect reps? So when you rotate to the right, head goes right also. Okay. So like she just did, her whole body now is rotating left instead of the head staying independently rotated from the thorax. All right, that's perfect. Okay, so we're in the middle. Why don't we step your right leg forward? And again, if you need padding for your knee, I would do that, or double fold your mat, use a pillow or a blanket or a towel. Let's start with both hands on top of the knee. And then we're just going to drive the knee over the toes about 4 times, okay? So as she goes into this active dorsiflexion, her front heel is staying down, all right? And that's it. Again, you can do 4 to 12 reps. Right now, she's just going to be doing about 4 or 5. Okay, you come to a vertical shin, reach your hands forward, and then just start to lean. So if you notice, she's about 30 degrees, maybe even 45, over her front thigh. You'll know you're doing this correctly if you start to feel your front leg kick on, because we're putting the upper body weight on the front leg. All right, and you might just hold for a moment. Okay, now, option from here is to put both hands on the floor inside the right foot. Okay, and then if this doesn't feel okay, you want to just grab those blocks. You can use your blocks, especially if you're somebody who has limited flexibility, strength, or balance. I definitely want you using the blocks. You can even put them higher if you need them. Okay, but in this instance, Jenna's hands are down. Okay, she's going to flip her left toes under and just straighten her left leg. It's easy. Okay, so she's in a low lunge position. Not even a low lunge. It's setting up for a full standing lunge. All right, can you reach your right arm out to a T? All right, and now she's going to do something called a shoulder car. So it's a big controlled articulation of her shoulder joint. All right, so she's going to draw a clock with her right arm as big as she can. Nice. Okay, and again, I'll remind you that the slower the better here. Okay, so let's do one the other way. Yep, so she's demonstrating 1 rep. And again, I would do anywhere from 4 to 8 repetitions. Slower is better. Good, both hands come down. All right, and then let's just do it twice, but tap your back knee to the floor. So that's 1. All right, you'll do it again. All right, and then Jenna has the tissue potential, so she's going to keep her hands down and start to straighten her right leg, keeping her torso on her front thigh and letting her head drop. Okay. And again, if this is difficult for you, you might even do reps of it. So you might do it 2 to 4 times where you're just bending and straightening your right knee. Okay. And then whenever you're ready, Jenna, you can bend it to that front knee, lower the back knee. All right. Now keep your legs where they are, come all the way up to a tall position, so feet stay where they are. And she's coming all the way up to a yoga full lunge, all right? So if you bring your elbows by your sides, all right, and then lean about 30 to 45 degrees forward, all right, and now we're going to be working the right legs even more. Okay, now I want you to think about your low back here and see if you can add a slight posterior tilt of your pelvis. All right, and then you're going to reach your left arm forward and your right arm backward. That's it. And then we're just going to start to hold. Okay, ways to make this more difficult. You can bend your left knee closer to the ground. Okay, you might pick up your right heel. It's not necessary to do all of this at the start. You can just keep that heel down. You can keep that left knee straight. But the idea is to be reaching your armpits further and your hands further away from each other. All right, and then I want you to swim that right arm all the way forward. Good, control your left knee to the ground. Sweep your right leg back. All right, and let's do the left side. So left leg goes forward, hands on the knee, and then you're just going to let your body weight go into that passive, active dorsiflexion a few times. Great. And then after this next one, you're going to reach your hands to the opposite side of the room. Okay? And then lean over your thigh. Good. One thing we didn't do on the other side that you can also do on this side if it feels okay is you can actually pull your back heel toward your butt. Okay? And that's going to isolate or co-contract your hamstring a little bit more with the quad. All right, and Jenna's still thinking about keeping her tail under her a little bit, and every time she breathes out, trying to get that navel to her spine. All right, the back foot's going to come down. All right, let's bring the hands to the floor, and then we'll do those 4 knee taps with the right leg. So it's up, and she's just controlling that knee down. If it causes you any pain or discomfort, I just wouldn't go all the way to the floor. Okay, another thing to think about is your navel close to the spine. All right, and on this next one, her leg is straight. Okay, she's going to reach her left arm out to a T, and then she'll do one shoulder car on each side. Okay, so it's just like a big freestyle stroke forward and then backward. That's great. Then she can put both hands down and straighten that left leg. Okay, you hold for as long as you'd like, but it's really important you keep as much of the front of your body on your thigh as possible. That's going to help the back of your spine and your spinal cord actually let go and release and or relax. Okay, she'll bend into that left knee. All right, let's bring the right knee all the way to the ground. Just pause for a moment. All right, and she can do it with her hands or without her hands, but just come up to that lunge position. Good. She's going to walk her hands all the way up. Okay. Then from here, she leans forward about 45 degrees. She's going to take her left arm back, and now her hands are trying to move away from each other. You'll feel a slight left rotation of your rib cage. All right, and again, if you want to make it more challenging, you could take your back knee closer to the ground or lift your front heel. Okay, again, it's not necessary. I would say you get really good at this with the straight leg first. All right, and then when you're ready, you're going to bring both hands down, bring your back knee to the floor. Good. Come up, sweep the leg back. Yep, to a tabletop. To a plank. All right, and then just walk your hands to your feet, put your butt on the wall. So you're in a forward fold, letting your hips be on the wall, put your hands on your calves. All right, and you can just straighten and bend your knees 1 or 2 times. And then keep a knee bend and roll your spine all the way up on the wall. And take a breath, smile, and that's your home movement practice. All right, great. Give it a go.